We actually have the pleasure of a team presentation. So it would be Wang and Julie Herman from the Pharmaceutical Sciences Department, and they're going to be focusing more on small molecule workflows. And they have quite an impressive group. I think they have over 20 workflows focused on small molecule preformulation and solid dosage form workflows. And so with that, I'll turn it over to Wang.
Thank you, Paul.
It's not too close. I speak pretty loud.
Can you hear me?
Okay, thank you.
Okay, good. Thank you.
Turn this on.
So this is the last presentation before the lunch. So hope we all can have a little bit patience to go through this slide. So my topic will focus on the small molecule. We will give you the case studies from the experimental design, how we handle the execution of the experiment, until how we generate the report. So for some very interesting workflows. And for me, I will give an overview. I will give an overview of the automation lab in the Janssen beer site. And for my colleague, she will give you more detailed case studies on how to handle the pretty water-soluble compounds in the automation platform. So this is a disclaimer, just means this is a formal presentation, but this is some request from our colleague from the law department. So here is the outline. First, we will have the background and challenges. Then I will give you an overview of LEA Platform in Janssen Beer's campus. So case studies, I will walk you through the exhibit compatibility studies. And my colleague, Julie, she will walk you through the PS screen, solid dispersion screen, and nanosuspension screens. Those are the key screens we handle the pretty water-soluble compounds. So this is the overview of Janssen Pharmaceutical Beer's one site. We are mainly focusing on the small molecule development, and we have 4,500 colleagues working in this site. So this will give you an idea of where we are. We are mainly here. We do the developments for the NME and phase 1. So the major activities include salt polymorph screen, exhibit compatibilities, and force degradations. And we also suggest in the formulation trajectories, as well as suggest the manufacturing platforms. We mainly here, but we are trying to be end-to-end in the organization. That means we also support phase 1 and 2 and phase 3, and also the discovery phase. So whenever you have a platform, there should be a philosophy behind this platform. This is our philosophy in developing the high throughput screening. So many people talking about formulation development. In fact, formulation never stands alone. Whenever there's a formulation, it should be developed for a process. So our philosophy is when we're developing the formulation, we keep an eye on the downstream process. Is it going to be a tablet? Is it going to be a capsule? Is it going to be the bead coating? Is it going to be a spray drying process? So that we call it pull and push approach. So I have some cartoons to show this philosophy in the product development pipeline. So when we're doing the formulation screens in the high throughput mode, we keep an eye on the manufacturing process, and we scale down, miniaturize. After we develop, we scale up. At the same time, we also keep an eye on the PK support. We're trying to mimic the actual situations for the PK studies so that our screening result is meaningful and reproducible for them. So this is an overview of our lab in Janssen Beer site. We have more than 20 automation workflows here. So we are supporting not only API, drug development, we also supply the Janssen supply chain, which is manufacturing side. So when we're talking about high throughput screen, many people think it's only DOE plus automation equipment, maybe a UPLC or UV plate reader. Is it really true? So this is another analogy. This means you have a single knife, you will cut the banana faster with this tool, and you have a single pipette, you have a 96 channel pipette head. Is this equals high throughput screening? Definitely not. Because when you have more and more experiment to handle, the information you need to handle across this experiment is going to increase exponentially. So you have the DOE software, you have the dispensing software for different equipment, and analysis, also reporting. Are you going to handle so many data in Excel? Is that what you are facing now? This is what we need. We need a centralized information storage, which is able to give us a DOE access, dispensing access, analysis access, and also which is going to give us reporting very fast, give us the information, not the data. So this slide is very similar to my colleague Steve because we are using the same platform there. So what you see here, LEA is in the center. It's a database. It offers data access to the DOE, execution of the experiment, and in the middle of the experiment, you can query your data very easily from CIMIC's data browser. And we have another program which is called LEA Data Viewer. From there, you can do some data processing to check your data. For example, when you're taking images to check whether your formulation is able to dissolve your compound, then besides we have automatic algorithm to look at whether it's clear or not clear, you can give a mark on that image to say, okay, it's clear or not clear, to double confirm. And all this information will be saved in the LEA database directly. So in the end, with our screens, we have a program called Pipeline Pilot, which is able to extract information from the LEA database and manipulate the data and put in the format you really want and generate a report automatically. So this is a sample report you see from our screens. This is an overview of the LEA platform in beer site. We have 15 instrument pieces integrated into the free-slate LEA platform, and some are direct integration, like UPLC, CM3, pitch model, and some are integrated in the way of LEA data uploader, like XRD. So I will walk through the case study 1 exhibiting compatibility screens we are doing there. So here is usually how the exhibiting compatibility screen is done. So first, we do the powder dispensing. We mix the powder. It's mainly the API and different excipients. And then you put those powder blends into different stretching conditions. Mainly we play with temperature and relative humidity. This is because temperature will change your reaction kinetics, and relative humidity is going to pull your molecule together. It's most commonly same plasticizer in this case. And in the end, we probably push the samples into the UPLC analysis to see whether they are compatible or not compatible. And here are 3 major approaches when we're doing the excipient compatibility. The first is 1-to-1 mixture. That means you blend your API and your excipient in a 1-to-1 ratio. The problem of this approach is for some excipients, like magnesium stearate, you never have a 1-to-1 blend in your real formulation. So it may overestimate, and also it may underestimate, because in some case, the incompatibility is not between a single excipient and a single API. It's going to be an interaction between 3 or more materials. So that's where the N-1 method can fit in. So in this approach, first you get your full blend ready, and then put them into the stretching conditions and to the analytical equipment. If they're compatible, okay, you are lucky. If they are not compatible, you take out one exhibit at one time, and then you are preserving most of the combinations, and then we will try to figure out which exhibit is playing a more important role there. So the last approach is DOE approach, and of course it's going to give you more information about your kinetics, about different stressing conditions, but you are going to have to prepare a lot of samples. In the past, we mainly using this approach, first the full blend, and then go to the N-1 method. This is like going to the lottery, whether you are going to get the blend working or not working. This is mainly because we are facing problems with powder dispensing. In the early stage, you are not going to get a lot of material. So the whole department is going to get like 10 grams. In the end, we have to use less material, and we also have the time constraints. We need to dispense those APS and excipients accurately in a small amount. So the next challenge is about how to mix a powder homogeneously in a very small scale. And the last one is we are trying to mimic the actual situation as much as possible. If it's going to be a tablet in the final formulation, we try to compact it. If it's a capsule, we don't. So this is the overlook of this experimental design we have done in the last few months. You can see that it has 8 binary mixtures and 4 full blends, 8 different stressing conditions. So we have 96 samples in total. So all this experiment, it needs 300 plus dispensing map. So for some DOE approach, you may need 800 or even 1,000 powder dispensing tags, powder dispensing maps in a single screen. So in total, you need 1.9 grams of API for this study. So this is how this whole dispensing will work. We have CM3. We all know about the SV hopper. This is very interesting for us because it can dispense accurately and it doesn't use a lot of material. This is what we really need. So here you see some movies, how the SV hopper is picked up. Now it's picking up the tool, it's a hopper, and it's going to the balance to do the dispensing. The real CM3 is not so fast. This is the fast version to save the time. Okay, so after dispensing all the real-time dispensing, the actual dispense rate, you can check it in the CMix data browser. So in the end report, we will include this information through the pipelines here. And now we're talking about mixing in a small scale. I look at this in a process optimization way. That means you have to do your experiments in your own platform. Those parameters include mixing time, mixing intensity, and API excipient ratio, and the load, the vial size, and with without magnetic stir bar. Those factors are all will influence how homogeneous you can reach in a small scale mixing. So we are also trying to develop using the near-infrared imager to look at mixing homogeneity, and this is still under development. So this is the pipeline pilot protocol, how it looks like. So on the left, you say it takes the data from the source, and across the pipeline, the data will flow the pipeline, and on each component, it's going to get processed, manipulated, and in the end, it's going to give you the report you need. So from this report, you can say here, this excipient is giving trouble. It's having some incompatibilities from the assay. And here you have a heat map of the impurities from the UPLC. And the intensity of impurities is color-coded here. From here, you can easily tell these 3 guys is giving us trouble in the excipient compatibility studies. It's very straightforward, so you don't have to go through your Excel tables to look at data after data. One overlook, you will know which is good, which is bad. So the second case study is a current study we are collaborating with Free Slate. we are trying to miniaturize the powder flowability measurement with CM3. So when we're starting this project, the rationale is still driven by manufacturing. This is because when you're putting your product into the manufacturing platform, you want to decrease the number of unit operations as much as possible. That means if you can do it in direct compression, you will not go to the wet granulation platform, because in the wet granulation platform, you will need a mixing, granulation, drying, milling, blending again. So all these unit operations will increase the cost. So that's why we are trying to drive even the new compound into the direct compression platform as much as possible. But the API development, people need time to optimize the API properties, especially flowability. This is very critical for the direct compression studies. And if you put your API in the direct compression platform, the property of API will become more important. And again, in the early stage, we don't have a lot of material to play with. And what is a gold standard for measuring flowability? It's an angle repose. It means you pour your powder on a disc, and then it will form a cone. And this angle is called angle repose. So if your powder flowability is good, so this cone will be small. But if your powder is sticky and not flowing well, it will have a very steep cone. But this approach, you need probably from 10 to 20 grams of API. So in the early stage, that's all we get. So you may be very familiar with, this is a classic powder dispense head. And the structure is like this. You have a valve in the middle, and you have a shaft from the same tree to push it down and turn it. So there are two parameters you can play with. The first will be how large your opening is. The second one is how fast you turn it. So these two parameters will determine how fast your material can be dispensed. And if we are using the same dispensing parameter, we hope that this approach will give us a feeling of how good the powder flows and how bad the powder flows. If the powder flowability is good, we will see a very deep dispensing curve. If the powder flowability is poor, then the dispensing curve will be flat. So this is a quick view of our preliminary data from 4 different materials. So you can see the axis from this direction is how big you're opening the valve. And from this axis on a small scale is how fast your classic dispense head is rotating. So if we look at individual graph, it really makes sense that if you go to higher valve opening, the dispense profile will go deeper. And if you drive that dispense head faster, it will also dispense faster. And if we compare those 4 materials, we know that lactose direct compression gives us the best flowability, and then followed by MCC direct compression, and then is mannitol, the worst probably the lactose 200 mesh. And if you compare these 4 graphs, it's really giving us the same order. But we want these parameters to be correlated to our gold standard, which is angle repose measurement. We're using some partial least square regression techniques to put the CM3 dispensing profiles and the other powder properties like particle size, shape, bulk tap density, and to construct this model. So we can see from here, by using 5 principal components, you can explain over 95% of variance of angle repose. So that is all for my study. Next presentation, my colleague JD will share with you how we handle poorly water-soluble drugs in the automation platform. Yes, yes.
Can everyone hear me well? Okay. Morning, everyone. I would like to present you today some more about the high throughput screening work we perform on drug product formulation. First of all, I would like to give some background information, and after that, some strategies how we can improve solubility. Further, I explain the high throughput formulation screens, which helps us to improve the solubility, and some case studies. So what is important for an oral drug candidate? So once we get an oral drug candidate, we have to make sure that these will dissolve and that the API can also be absorbed at the absorption site and that it goes to the blood circulation. Another important aspect is that we have a good metabolic stability. But this becomes more and more a challenge because it seems in comparison than what Steven was telling us, he can reach like 200 mg per mil solubility results. We are not so having these results, so for us it's more difficult in the small molecules. We're getting less water-soluble compounds, many. So you can see here in this graph, during the years we see really a growth of less soluble compounds, so it becomes more and more a challenge here. And all the molecules become more complex, so which ends in a very low bioavailability. So further, I would like to show you some strategies how we can improve dissolution rate, so how we can improve the solubility. So a first strategy is by adding some surfactants and co-solvents. We're also testing the synergistic effects by combining different excipients. And for example, by getting a higher readability, we can also improve our solubility. Another strategy is by removing the crystallinity and create amorphous systems. So if we create an amorphous system, we will also get a better dissolution rate, so higher solubility. Because in an amorphous system here, we need less energy to break. Because if we have the crystal lattice here, we need more energy to break the crystal lattice in comparison with the amorphous system. A third strategy is the particle size reduction. So by increasing the surface area over here, like you see in the Noyce-Whitney equation, if we increase the surface area, we can reach a higher dissolution rate. So we're going to mill our particles to a nanometer size, and by this we will have a better dissolution rate. So how do we do that in the screening work? So this is, for the first strategy, we're going to add the surfactants or co-solvents. We have a screen which is the solubility screen, where we will screen against a large number of combinations of excipients. We have two different kind of screens. The first one is the aqueous liquid formulation screen. The other one is, we call it the organic screen or the co-solvent lipid-based formulation screen, where we will screen against, for a standard screen, like 64 formulations. We screen in triplicates. We have different combinations of excipients in the aqueous formulation screen, water miscible solvents, surfactants, different additives. So we can also combine all these. We have 4 dilutions in each experiment. So we can start from 50 mg per mil to 10 mg per mil. And for a typical screen, we need here less than 600 milligram. This is for a target concentration of 50 mg per mil. For the other screen, for the organic screen, we have for a standard screen like 128 formulations. We screen again in triplicates. We have different pure excipients, also oils, cyclodextrins included. Again, 4 dilutions per experiment. And for this screen, we typically need less than 1.1 gram. So this is again for a target of 50 mg per mil. This is the overview of a solubility screen. So first of all, we're going to create our master mix block. We do this with the Hamilton liquid dispenser. We can also do this with our CM3 module. So we mix all our excipient combinations in the master mix block. This block will be mixed very well on our vortex mixer. When we prepare this master mix block, we still have to prepare our API 96 well plate. This is a clear well plate, and we will dispense the powder with the powder neon, or also our CM3 platform, where we can dispense powder in 96 well plates. After we prepared everything, we're going to do the transfer step and transfer from the master mix block to the API plate a certain volume so that we can reach a target concentration of, for example, 50 mix per mil. We will do the overnight mixing. So we mix overnight. We are going, after 24 hours, we're going to put our plate on the vision station, and we will check if our wells are clear or not. If our wells are clear, we can say we reached here a target concentration of 50 mix per mil, so which is pretty good. But if we don't, we can do this cycle again and again. So we can do this 4 times. What we also can do is measure directly with UPLC to have an exact concentration determination, which we don't have with the imaging station, because there we are going to work in ranges. So we can say, for example, our formulation is clear at 25 mix per mil, so we reached a solubility higher than 25 mix per mil, but lower than 50 mix per mil. So we work in ranges there. So yeah, this is the complete overview. So what we do before we start the experiment is the design of experiment. After that, we're going to dispense in our 96 well plates, so the API, the powder. We have the Hamilton liquid starter dispenser, where we can make the master mix blocks with. So we start the experiment, and we're going to take images. We are also able to measure the concentration with our UPLC, and all this data is again imported and saved in the LEA database. After that, we can look to the LEA data viewer over here, and you see different images. So here it's experiment in duplicate and not in triplicate. Sorry. So we see the images. Here it's an example of not soluble, so you see still that there is API in the well. Unfortunately, there is no clear well here. So you have to go to a next step. This is a case study. This was a compound which was very low soluble, and if I say a really low soluble, less than 0.01 mix per mil. So it's a big challenge there. So first of all, the formulators made a micronized sample of that specific compound, and we saw that the bioavailability was very low. So we did a solubility screen, and we saw there we had 2 hits, one of 5 mix per mil and one with PEC 400, where we reached almost 10 mix per mil. And after that, we were performing a PK study of this compound in PEC 400. So it's different doses, 10, 40, and 100 mix doses was used for the PK study. And we see there, if you compare the same doses of 40 mix per kilogram for this PK rat study, we have a 5 times increase already reached with this hit from the solubility screen. If we go a little further, then we have the precipitation inhibition screen, which I will explain a little later. We screened here for a good precipitation inhibitor, and it was vitamin E TPGS, which was the only one from coming out of this screen. So we combined this PEC 400 with vitamin E TPGS, and we see in the 100 mix per kilogram dose a difference of, we have a 9 times increase in bioavailability, which is a huge improvement there. So you can see that it's really important to screen and to pick out the hits from there. So another strategy when, for example, when we don't find a good oral formulation, liquid formulation, we can go to a second strategy, and it's by removing the crystallinity and create an amorphous system. So if we create an amorphous system, we will also get a higher dissolution rate. So first of all, if you look to this graph, the first curve you see here is just a crystalline powder, which is giving a very low dissolution rate. What we have to do is try to create a supersaturated solution, which we call a spring. But this supersaturated solution is not the most stable solution. So once the API dissolves, it's tending to crash out again. So therefore, we need to screen for excipients which will stabilize this supersaturated solution. So that is what we actually do over here. So we create a supersaturated solution and add excipients which will keep our formulation much longer in the metastable zone. So this is something we perform with the precipitation inhibition screening. After we did the precipitation inhibition screening, we're going to perform a solid dispersion screen. This is a miniaturized screen for the spray drying experiment. So it's what you see over here, the spray dryer. But we do this miniaturized in our platform. After that, we are going to perform also dissolution on this miniaturized solid dispersion screen. So this is an overview of the precipitation inhibition screen. So again, design of experiment, making the different combinations with our liquid dispenser. We will add an API stock solution to our excipient solutions to create there the supersaturated solution. We will measure the turbidity with our UV plate reader. So it's also a 96 plate reader. And we can, here in this graph, we see the turbidity that we will measure during 2 hours on 37 degrees. So here in the beginning, you can see it's 1 hour, still clear. So we can say for 1 hour we have no precipitation. But after 1 hour, we see precipitation coming up. We have an extra check with our vision station, so the imaging station. This imaging station can take images in the beginning and also at the end. So we see here what we see in the graph, still clear in the beginning, and at the end we have precipitation. So all these results are again stored in the LEA database, and we're going to look into LEA Data Viewer to our results, where we can see all our graphs, so the turbidity plots, and the images of before and after the experiment. So here in this raster, you can color code all the wells to be the one which are precipitated. We color code red, or here it's yellow. We changed it after. And green, which are not precipitated. So after that, we are going to bring this in a report. So we have the reporting tool. It's a pipeline pilot, a report, and this report is going to extract all these results from the database. And you can see here, for each formulation, we have an overview what the formulation is, what the ratio is. You get directly the plot, so the turbidity plot. You get the images before and after. You get all the markings which are extracted from LEA Data Viewer, and the pH measurement, because the pH, we measure also the pH before and after, just to make sure that the pH is giving an influence or not. So once we found good precipitation inhibitors, we can go to a solid dispersion screen. So here on the screen you see an example of a design here. This is only binary formulations, but we want to create amorphous films in a solid dispersion screen. So we will combine API and polymer as a binary combination, or we can also make ternary combinations with the API, the polymer, and the additive coming from the precipitation inhibition screen. So we include this excipient from that previous screen in our solid dispersion screen. So once we made these combinations in a block, what you see here, we call this the master mix block. We're going to transfer and make film casting plates. Here there are 6, but we can go also to 9 plates. And we will perform dissolution on these films. So each plate represents a time point in our dissolution curve. So at the end, we will have 96 different formulations coming from one block, and we will have 96 different dissolution plots. Again, the overview of the solid dispersion screen, design of experiment in Library Studio, dispensing, so making the combinations with the Hamilton starlet. We're going to transfer from our master mix to our film casting plates. We're going to put these film casting plates in the oven, evaporate very quickly the solvent off. So we want to create, by this way, the amorphous films. And we're going to perform dissolution on these plates. We will measure the concentration or with a UV plate reader or with our UPLC instrument. And all these results are, again, imported in the LEA database. And we are going to make a report with our dissolution graphs. So normally we do a screen of 3 plates. It means 96 wells, 3 plates, and if we have a 2-stage dissolution, we will have 9 data points. So it means we have in total over 2,500 data points, which is really a lot. And we have in total like 244 dissolution curves. So before the integration of the LEA, so before the integration of the pipeline pilot reporting tool, it took me 2 to 3 days to make these curves. After the integration, which is going much faster now, we need only 5 minutes with pipeline pilot to generate 244 dissolution plots, which is really a big improvement. So, yeah. I think no one will be happy if I tell I can make a good pie and give you just eggs and flour. So I cannot give only the results from the database, because if I would give these results, these 2,500 data points to you, I think no one will be happy, and it will be very difficult to make a conclusion. So what do? We make the report in Pipeline Pilot, and we get here the dissolution plots. We also have the pure API. So we see here the pure API has a very low dissolution rate. If we look then, for example, to this one, we see 80% dissolved at the end of, I think, 1.5 hour dissolution. So you can easily pick out the hits from here or over here and differentiate there. So it's really important to have these graphs. This is a case study where a PI screen and a solid dispersion screen was included. We screened there for the precipitation inhibition screens for 40 excipients at 4 concentrations, and we saw that soyotol, poloxamer, and vitamin E TPGS were giving good results, so these were good inhibitors. After that, we were starting a solid dispersion screen where we included these 3 excipients as a ternary combination. So finally, we found out that the combinations with cyclodextrins, vitamin E TPGS, and the metal cell gave very good results. So if you look here to the dissolution plots, the API on itself doesn't reach even 20%. The HPMC on its own, not a big difference. But once you see the ternary combinations, so with the hits from the PI screen, we see a dissolution rate about 80%. And also for this one, cyclodextrins with TPGS, we almost reach 80%. So it's a big improvement in comparison with the API itself. We are going to pick these hits and do a scale up. So underneath you see the formulations which are scaled up, and to make a comparison on large scale, we took the hits from over here, the HPMC on itself, the API, and a nano tablet. And if we look then to the dissolution results from the larger scales, from the upscaled formulations, we see actually comparable results coming up. So again, the first formulation was the hit we had over here. And further, so if you look then to the C, it was the HPMC on itself, which is a lower dissolution rate, and the API on its own, again, very low. So we can see that we have, in between solid dispersion screen and the scale-up, very comparable results. Further, if we performed a PK study, so a rat study, and we saw that the bioavailability has the same, so it's a good correlation between in vivo and in vitro. So the ranking from over here, from the dissolution results, is similar like the PK study. So the bioavailability has the same ranking like over here. So we can say we have a good correlation in vivo and in vitro. So again, very important to do all this screening work. As last, there is a third strategy to improve the dissolution rate, and that is the particle size reduction. We want to, we do this with nanomilling, so we're going to mill this compound to nanometer range. And we're going to stress also these nanosuspensions. We're measuring the particle size of these nanosuspensions with the Malvern laser diffraction meter. And we will also upload all our results in the LEA database. And we can generate a report with Pipeline Pilot. This nanomilling is a high-share milling process. And then as last, a case study about from the nanosuspensions. Again, an example with a very low solubility. We screened here 10 formulations with different stabilizer solutions. And we saw at the end that we have only 4 of these formulations which were hits. So what we have here, we do this, we stress these hits, and we see at the end, after stressing conditions, that we have, for example, this is the distribution, so the particle distribution of API poloxamer 338. We saw that the stability is very, very good because it's identical, the particle size there. If we look to the formulation with HPC, we can see that it's actually unstable because we form here agglomerates. So finally, the advantages of a small-scale automated screen is for sure that we have a much broader design space and we get broader knowledge after screening this. It's time-consuming, so we need less man-hours. And we need also less material because we work now in 96 well plates. And finally, which is really important for business, is that it's cost-effective. So we would like to thank also our leaders and people who worked with us to reach this point. And also special thanks to the whole Free Slate team. Thank you. So if you have any questions for Likun or myself, go ahead.
Do you use Library Studio to do design experiments?
Yeah. Yes, we do the design of experiment every time in Library Studio for all our screening work.
Okay. Like do you use statistical software?
No, we don't.
Currently, no, but we have a D&D special version we call Screen Designer. It works like a plug-in in the Library Studio.
Okay.
So it's very specific for our screen works. So in that software, we can generate combinations. Normally, it's full factorial design, and we'll transfer all the tags and chemicals you need into the Library Studio.
Okay, thanks.
I was curious how you were getting the kinetic dissolution data. You were getting, I don't know how many data points you were getting per well, but it looked like it was, at least 5 to 10, somewhere in that range. Mm-hmm. And that's over 96 wells, and you mentioned either using UPLC or some other technique.
Yeah.
How were you getting the sampling over that 96 well plate? I couldn't tell how long the time frame was, but I assume it's within an hour or two or something like that.
He means the time frames to do all the... You mean the time frames to do the full experiment? So first of all, we are going to dispense with our robot and bring this into these 96 well plates. And the time frame for preparation, it doesn't take so long to create these films. I think it's an hour from starting from Hamilton, dispense, evaporate, and to create these films. I think in between half an hour to dispense, but the film plates are evaporating for an hour, so take 1.5 hours.
So after you make the amorphous material and then you dissolve that or you add a solution to that with your additives, then you're getting kinetic profiling data of the concentration of the API in that solution, right?
Yeah.
So the question I have is, how are you able to get all that data in such a short period of time over the course of that 96 well plate, and so that they're matching up well with the desired time points? I mean, presumably you have a multi-channel pipette of some
Yeah,
kind.
we have multi-channel pipettes, so we transfer from one plate to the other. We do the filtration, measure the concentration with UPLC, and this data is then imported in the LEA database, and we extract this concentration and calculate it to % dissolved during time, and we plot this in curves.
So you're saying that you have another 96 well plate for every single data point, and that you have, what, a 12-channel pipette that is taking 8 samples and transferring to a different 96 well plate for every single data point?
We transfer from plate to plate.
Point.
So we can filter in plates. So we transfer with the 96 channel head to another filter plate. So we take out every plate on a different time point. So this plate represents actually time points in the dissolution curve. So if you take out that plate, we will filter and dilute the plate, and we do that with the 96 channel head. So it's taking a minute to do the transfer. And we do this for these 9 plates, film plates, after each other, so on different time points. And these will be measured after that with UV, which is going very quickly. And after that, all the data is imported and we can plot it.
Okay, thank you.
Maybe I have another extra little comment. Of course, it's not possible for you to have a single block sampled 9 times during the dissolution, but you can create 9 different blocks, and each block is used for each time point. Did that answer your question?
So I noticed you have 8 conditions for exhibit compatibility study.
Yes.
Are those conditions universal for no matter what exhibits?
And it's not universal. Normally, we have the force degradation studies before that. So we will have some suggestions from the formulator and the chemist for those conditions. Sometimes we cannot use too harsh conditions for the compound. So that condition will be different from compound to compound.
Thank you.